Hey folks, Judge Executive Al Mattingly here. It's October the 14th, 2020, and I thought I would just take an opportunity to give you a little update on what's going on in Daviess County regarding the COVID-19 virus. This morning I was on a Zoom meeting with approximately 170 county judges and mayors and the governor, and we were talking about things that were going on throughout the state. And the main gist of the governor's comments was that we need to work together to try to flatten or plateau the latest outbreak by COVID. Uh, back probably in April, May, we plateaued at about 100 cases a day. Then in June, July, we hit 500 cases a day. And now we are on an uptick at about 1,000 cases a day. We need to flatten that. We need to actually get it to start to come down. And one of the best ways of doing it is doing what the CDC, the White House, the governor, your local elected officials have been telling you, and that is to wear a mask, to social distance, to sanitize your hands, and avoid large crowds, large groups. One of the things that we're seeing throughout the state and here locally in Daviess County and the Green River District is that we're finding more and more cases being traced back to gatherings at weddings, large funeral groups, people who are having a little barbecue in the backyard, and instead of adhering to 10 people, maybe they have 15 or 20 people. All of those are contributing to the number of cases. Wearing a mask, one of the best things that you can do. I know that on quite a few occasions I've had people send me various CDC studies that say that wearing a mask doesn't do anything. Those studies, what most of the time I found, people have pulled out a little sentence or a graph and are trying to make their case. But the simple fact is, the only tools we have in our toolbox right now until a vaccine, a safe approved vaccine becomes available, is to wear the mask. I know that I'd had a call last week from a lady who said that she had come to the courthouse and there were some people without masks. We now have posted again on all the doors that for you to come into the common areas, the hallways, you need to wear a mask. To come into any of the offices, my office or the fiscal court's offices, you have to have your temperature taken, your name is recorded, you wear a mask. Many of our businesses are complying and doing what the governor has asked that they do. But then there are some that are not. I know that I happen to have gone to two supermarkets Saturday and I wore a mask. Everybody else was wearing a mask. And then I went to another market and nobody had a mask on. So it's wearing the mask really isn't there to protect you. It's to protect those folks who are around you, to prevent you from spreading the virus. I know Mayor Watson and I have talked. There are a lot of folks out there who do not wear their mask properly. And I think, if I'm not mistaken, on our webpage, if we don't have a little video showing you the proper way to wear the mask, we will have very soon. I think most of you know the proper way. Anytime the mask is down below your nose or below your chin, it's not doing you any good. You may as well just not wear one. Believe it or not, face shields, they don't do a lot to protect people from the airborne spread of COVID. Now, they certainly will protect people from aerosol droplets from your mouth or from your nose, but you're still getting those droplets down below and contaminating surfaces. The idea is to contain any virus particles that might come out of your body within the mask. In Daviess County and certainly in the Green River District Health Department's area, which are the 7 RAD counties, would be Hancock County, Ohio County, McLean County, Webster, Union, Henderson, and Daviess County. We're seeing a real uptake in the number of cases that are occurring in seniors, in the senior population. Used to be that the 20 to 40 age group, the vast majority of the cases were occurring there. And we were getting cases in that infant to 20 age group, and we were getting cases 40 to 60. But now the vast majority of the cases are occurring in our senior population, that's 60 plus. And the vast majority of folks who are running into complications and who are passing away occur in that senior group of folks. We have had an outbreak, as have other counties, in our nursing homes. We are trying to address that. Clay Horton and his staff at the health department are doing an excellent job with the very limited staff that they have. The contact tracers are doing a good job in tracking and tracing active cases. But the simple fact is we just don't have enough people or enough time to do that. I've had calls from folks about non-compliance. The best thing for you to do is call the hotline, Kentucky COVID-19, ky.gov. And you can find all the information there about who you should contact. Not only that, you will see all the latest state statistics, and then you can go on and look at county by county statistics. Most of the statistical information now is being given out in cases per 100,000. Daviess County is kind of an anomaly there because we have exactly 100,000 people. So if I tell you that we are averaging 25 cases per day in Daviess County, that is actually 25 cases per 100,000. If I told you that Henderson County was averaging 25 cases a day, that would be like Daviess County averaging 50 cases, because Henderson County's population is approximately half of ours. Ohio County, they've got about 20,000 people, so you would multiply their number of cases, their number of deaths, their number of hospitalizations by 5. Hancock County has 9,000 people, as well as McLean, so you would multiply their numbers times 10. My sister county, our sister county, Henderson County, is really struggling right now. They have a large nursing home complex, and there's a considerable outbreak there. I know the mayor Alston and Judge Snyder are working really hard to overcome what's going on there. I'm trying to get the governor and Dr. Stack to meet with our Bragg County judges to talk about what we can do as a region. Understand, viruses know no county boundaries. They know no city-county line. As we travel in and out, we can take whatever we have within our body with us, and we can leave it somewhere else. So we need to be cognizant of that. Just for your information, today we have had 1,696 positive cases in Daviess County since they've been tracking COVID. We've had 1,441 of those cases recover. We currently have 231 people who are positive. We have currently in the hospital 12 folks. In ever having been hospitalized, 123 folks, and we have had 24 deaths in Daviess County. Doesn't sound like a lot when you're talking about a population of 100, but think about it, we are now at 1,696. That means 1.6%, 1.7% of our population has been infected. Certainly the flu, when we have flu epidemics through our flu infections through the winter months, you seem to have more people than that. But I can tell you that this is real, and particularly in our elderly, it's critical, it's serious, and it's deadly. So I want everyone, if you would, to let's try over the next 2 weeks to bring down the rate of infection. Let's try to bring down the number of cases. Let's try to bring down the number of people who require hospitalization, because the number of people who die from this is directly related to the number of people who are infected, who end up in the hospital and end up on ventilators. So I'm going to try to do this at least once every week. There is a world of information on Kentucky COVID. .ky.gov. There's a world of information on the Daviess County Facebook page, world of information on the Green River District Health Department's page. More information than you would ever want to look. I've gone on the CDC's webpage and reviewed some statements made by folks who really don't believe that this is as serious as it's made out to be. Believe me, it is absolutely serious. So let's get through the next couple of weeks. Hopefully we don't see a big uptick because people who came back from fall break. Let's try to minimize those backyard meetings and greetings. Let's try to get down the number of cases that are tracked back to weddings and other large gatherings, because let me tell you, the capacity at our bars, the capacity in our restaurants are directly related to where we're at right now. And the restaurant owners I know, the bar owners I know, they're struggling. They need to open their businesses back up to the larger population. We've lost some of those folks and they're not going to come back. So let's see what we can do about overcoming, particularly in Daviess County. Last week we were in the red zone. We slipped in the red zone for a little bit. We then came back into the orange zone. The number of cases in Daviess County the last couple of days have been pretty good compared to what they were the last 2 or 3 weeks. Let's continue to keep it there, and perhaps we can get it out of orange into yellow. It would be great if going into Thanksgiving we were down into the yellow or even into the green. So I can't do it by myself. The governor can't do it by himself. We all need us working together so that we can make this a safe community for all of our citizens, and so that we all come out on the other side without too much damage to our economy and to our community's health. So talk to you next week again. I'm going to try, like I said, to do this on a regular basis as long as COVID is here. So if you've seen this video, come back and look again next Wednesday. Thanks. See ya. Have a safe day.